Good afternoon, everybody. I posted a statement on UK podiatry. It was a quote, in fact, because I was interested in what people's views on it were. It was a contentious statement about biomechanics, pathomechanics, and it was talking about what a normal foot is. I didn't intend that to be a discussion on this. In fact, I was rather hoping that the discussion wouldn't be necessary. But it seems to have caused one, and since anybody who asks for opinion should be willing to offer one, I thought I would do a quick video just to describe my problems with the statement. So to read it out, I'll try and throw it up on the screen. The statement was: normal neutral foot alignment is comprised of three things: neutral subtalar joint, vertical calcaneus in line with the lower leg, and metatarsal heads perpendicular to neutral calcaneus stroke subtalar joint. This is the position for optimal functioning of both passive and dynamic systems. I'll run through this individually because there's more that's wrong with this statement than right with it, and it might help to unwrap why I think that's the case. So first of all, there's the fact that they have in the very first sentence conflated normal with neutral. Normal has a very specific meaning. Normal means within one standard deviation of the mean. In statistical terms, that's what we mean. When we talk about somebody who is of normal height, we're not talking about optimal height or anything like that. We're talking about, we take a population of people with the short ones at one end, the tall ones at the other end. The majority will be in the middle, and these are the normal people. Neutral means something quite different, and there is a presumption in that first sentence that the two are the same thing, which of course they're not. We have some good normative data on this from Anthony Redmond, who did it using the foot posture index, and what he found was that in a normal asymptomatic population, normal was somewhat pronated. He was using the foot posture index scale, and I believe average off the top of my head is 3.7 pronated. Standard deviation on that, which is the band either side where most people are, where 68% of people are, was less than 3.7. I think it was 2.4 or 2.7, which means that neutral was actually abnormal. A neutral foot was very, very unusual. The people who had neutral feet were right up that end of the scale. And in terms of static position, I think we can all sort of relate to that in our everyday clinical practice. How often do you see a patient stand up and their foot is in neutral? Certainly it happens, but it's not common. It's certainly not average, which is what we are talking about when we're talking about normal. So if we ignore the normal and just talk about the neutral, we move on to the three criteria. A neutral subtalar joint. There's a couple of problems there. First of all, our measurement of subtalar joint is very unrepeatable. It's inaccurate, but that's a minor gripe. A bigger one is that we don't agree when we talk about neutral what neutral actually means. Most of us think that neutral is the position described by Merton Root in routine biomechanics, and that certainly is how he taught us to cast the foot when we make an orthotic. In fact, Merton Root used a different method for finding neutral. Merton's Root method for finding subtalar neutral was to put the foot through full range of inversion and eversion, and to find the position 2/3 of the way between maximal inversion and maximal eversion. Of course, this is not what most of us do. What most of us do these days is to use the subtalar head method, where we palpate the subtalar heads and we look for the position of maximum congruence that way. There is some normative data there. Root gave us some graphs of subtalar joint movement. McPoyle and Cornwall made some more about 20 years later. Both of their graphs look very similar. If you superimpose one line on top of another, the actual motion track is, they broadly agree. But their neutral lines are different. And that's because McPoyle and Cornwall were using tailor head congruence neutral, and Root was using 2/3, 1/3 neutral. So when we talk about neutral subtalar joint, far from being able to say that it's normal, we can't even agree on what that means. Vertical calcaneus is the second one. A few problems here. First of all, the measurement of a calcaneus is grossly unrepeatable. So from a clinical point of view, that's all but useless. We have this nice idea that a calcaneus is triangle shaped and that we can take a line from the apex of the triangle to the midline of the base of the triangle, and that's our midline. Of course, that's not true. The back of the calcaneus is splat shaped. There's a lot of anatomical variation. Haglund's nodes, that sort of thing, will bugger it even further. And trying to bisect a splat is much harder. If you imagine it as an egg, it's very hard to actually bisect an egg and agree on the line, which is why it's so unrepeatable, as has been found in more than one study. Lastly, it says metatarsal heads perpendicular to the calcaneus. This is the idea that when the rear foot is in neutral, the forefoot should be at 90 degrees perpendicular to it. We have normative data on this too. Garbelosa et al. In 1994 did a study on this, and they found that the majority of people had an inverted forefoot. They called it forefoot varus, which was inaccurate because they were also measuring supinatus. But irrespective, what they found is that 87 from memory, 87% of people had a significant inverted forefoot. If 87% of the population have something, then that is normal. If 80% of the population have 10 toes, 10 toes is the normal number of toes. You can't say that 11 toes would be better, and therefore we're going to call 11 toes normal, unless you live on the Isle of Sheppey. The last statement, though, is the most confusing and the most wrong. And it's something that we've been trying to move away from in biomechanics for a long time, and obviously there's a lot of work still to do. What it says is that this is the position for optimal functioning of both passive and dynamic systems. Now, if you don't fully understand that statement, it's because that statement doesn't actually make any sense. It's not only untrue, it is also incoherent. What I mean by that is, first of all, it talks about a position for optimal function. Now, function requires a range. A functional foot, and remember they are just talking about the foot here. Even if we give the benefit of the doubt and talk about the subtalar joint, it still makes no sense. A joint requires a range of movement in order to function. A subtalar joint which has no range of movement, if an orthopaedic surgeon has come along and stuck a bolt through it, for example, that is not a very effective foot. That foot is not functioning. That is just there at the end of the leg. So to say that there is a position for optimal function is not a reasonable statement to make. Does the foot pass through subtalar neutral during optimal function? Truthfully, we're not sure. It depends on what position of subtalar neutral you're talking about. To come back to the McPoyle and Cornwall data, their normal ranges didn't pass through subtalar neutral. Roots did. But what they agree on is that there is no position for optimal function. There is a range for optimal function. Subtalar neutral doesn't represent the start point nor the midpoint of that range. It is at best a point which that range will pass through. It also says it's the optimal position for functioning of both passive and dynamic systems. How do you have an optimal position for passive systems? That is a person standing still. How do you have an optimal position for static function? How would you define what is optimal in terms of position for static function? And lastly, leaving alone the fact that it's an oxymoron to describe an optimal position, it's also a huge assumption. There's no evidence offered by anybody, anywhere, for the contention that the subtalar neutral position is the optimal position for function. One cannot simply say that it is so. Hitchens' razor applies. That which is asserted without evidence can be dismissed without evidence. So from that point of view, it makes no sense. There's more that can be said on this, but I've already ranted for 10 minutes, and my stomach ulcer will be playing up if I do. But I just thought I ought to offer some of my views as to why this statement makes no sense. And if anyone has any other views, I would be most interested to hear them.